In this part 4, we are delving into the critical aspect of suturing, that is, the different types of suture needles. Needle tip points anatomy, friends. Basically, friends, these are basically there are 6 types of needle point tip available. That is the blunt point, taper cut needle, conventional cutting needle, reverse cutting needle, and side cutting needle or spatula needle. So we'll discuss one by one all the needle points, and it is important part of this video so that you understand where to use what and what are the advantage and disadvantage of one over the another. First of all, reverse cutting needle. So there is a cutting edge on the convex side of the curve. So the outer side of the needle, there is a cutting edge. So it penetrates tough tissue, making them ideal for skin closure and procedure involving dense and or fibrous tissue. So a friend, just remember that reverse cutting needle and basically traditional cutting needle, these will be the one of the most common needle that you will get. Used to during the initial part surgical career. This is the close-up view of a needle, and basically there's a triangular section of the this cutting edge, and it is not the whole basically length of the needle, only the last part, usually 1/3 part is where there's a cutting edge, the rest of the part will be normal flattened surface. So just understand that there is a cutting edge basically towards the outer side, and so this is tough tissue like tendon, sheath, and skin. So but again understand, as you take the curve of the needle, so there is a cutting edges towards the outer side. So as you pass the needle through the tissue, so there is no cutting edge towards the basically wound margin, so there is a lesser tear of the tissue. So as far as the coding is concerned, this is the 20 silk suture, and this will be a reverse triangle. So the cutting edge is toward the outer side, and as I said, you have to see that the cutting edge is not the whole. It is not cutting edge. It is only the last part. Usually the 1/3 circumference part of the length of needle is cutting edge. Rest is normal flattened. And again, the 45 written here is the length of the needle shaft, and 3 by 8 is the circle part of the circle. This length they have used in this needle. The next most common needle that you will use will be the basically conventional cutting needle. In the conventional cutting needle, the cutting edges towards the concave side, that is the inner side of the needle. So as you have to understand that as you pass the needle through the suture, then the cutting edge is basically towards the wound margin. So there is possibility of tearing or tissue damage. Here the leaflet is same, the needle which I have shown here, there is number 1 silk. So this is the, here again you see that there is a triangular shape, basically this logo over the needle, which is basically showing that the cutting edge is toward the concave inner side. And as I said earlier, in case the reverse cutting, this is the triangle will be reverse. So again, 60 mm is the shaft length, and 3 by 8 is the circumference they have used, and this is a conventional cutting number 1 silk suture. Due to the edges on the conventional side, needle is towards the concave side, so toward the incision or toward the wound. So these are avoided for tendons, reconstruction, and oral mucosa, because they can easily tear it out. Needle is blunt point needles. The tip of blunt point rounded body needle, because all blunt point these needles are round body only. One will be taper point, one will be taper cut, and one will be blunt point. So blunt point needles are round body needles, completely blunt to minimize unintended injury to viscera and surgeon's hand during abdominal wall closure, as it dilates rather than cut through the tissue. So it is simple logic that the tip of the needle is blunt rounded, so it will simply separate the tissue in front of the tip and will not cut it or will not pierce it. These needles are basically used during the surgery on very delicate tissue like maybe spleen, liver, or kidney, where basically we want to avoid the injury. As we insert the needle, it should not injure any other vital structure, and so there is a minimal collateral damage. Basically, blunt point will dilate its path rather than cutting it. Next, taper point needles. These needles have a sharp point, but basically it gradually the body, as I said, all these needle has a round body, so the round body gradually tapers to a point, sharp point. So there's a gradual tapering. These are very versatile and commonly used needle in general surgery, including soft tissue and GI procedures. And basically, they are more precise and there's a minimal tissue trauma. One is basically for demonstration purpose, the taper point needle for you guys. Here you can appreciate that the tip of the needle is basically whole round body, and then this gradually tapering to a point. So there is a gradual decline in the diameter of the needle. Next is side cutting point needles, and if you have used any of these needles like side cutting or the ski needle, do share the description and information in the comment section or in the chat option on the app. Basically, there is a cutting edge along sides of the needle shaft, and these needles are flat on both top and bottom, and basically they eliminate undesirable tissue cutout of other needles, and basically used in surgery on scleral or corneal tissue. So basically in opthal surgery they are used, and because they allow the needle to split through the thin layers and travel within these plane between them. Another important needle that you will come across is taper cut needle. So this is the taper cut needle which I discussed before also. That is number 5 suture ethibond used during the thecotomy surgery basically, and we have already uploaded a open thecotomy videos. Do check that out. And so this is number 5, and there is a basically a round circle, and in between which there is a triangular basically. Apricot needle is very versatile needle, friends, and although it is designed for use in sclerotic and calcified tissue in cardiovascular surgery, it is commonly used in hard fibrous fascia, which is difficult to penetrate. So it penetrates with ease, and further there is no damage because the rest of the shaft is round body. That brings us to the end of this video, and friends, just remember, every stitch you make brings you one step closer to the mastery. Embrace the challenge, embrace the journey, and become the skilled surgeon you aspire to.